Hey everyone, and welcome to The Explainer. Today, we're taking a hard, evidence-based look at the absolute explosion of social media's favorite weight loss drugs. If you've opened literally any app recently, you've seen them, right? The viral transformations, the glowing testimonials for medications like Mounjaro and Ozempic. But look, behind that perfectly curated aesthetic, there is a whole labyrinth of complex clinical data, hidden physiological costs, and a booming, frankly dangerous gray market. So we're going to strip away the filters today and look purely at the science. Oh, and real quick, if you find this breakdown helpful, please hit that like button and subscribe to the channel. It really helps us out.
Okay, let's dive right into this. You know, the gap between a quick 60-second viral clip and an actual peer-reviewed clinical trial, it is massive. Influencers are super quick to show off their shrinking waistlines, but they are consistently leaving out the critical context of how these incretin therapies actually hijack your endocrine system. And just to be clear, these are essentially drugs that mimic your body's natural fullness hormones. So to really understand what's going on here, we have to separate the genuine medical breakthroughs from the, well, dangerous aesthetic trends.
Section 1. The Mounjaro Miracle. Now we've got to start by acknowledging a core truth here. The hype does actually have a very real foundation in science. The medical community is genuinely excited. According to a recent systematic review on the efficacy and safety of these injectable incretin therapies, these drugs don't just shrink fat cells, they provide incredibly robust cardiometabolic benefits. I mean, we're looking at a staggering 14% reduction in major adverse cardiovascular events. That is a game changer. It validates that for patients dealing with genuine clinical obesity, these prescribed therapies offer undeniable cardiovascular and renal benefits. So it's not just about looking good, it's about actually extending your life.
And the science behind how they achieve this, it's absolutely fascinating. So unlike older single hormone drugs, tirzepatide, which is the active ingredient in Mounjaro, is a dual-action drug. It acts simultaneously on both GLP-1 and GIP receptors. By modulating your energy metabolism, vastly increasing your insulin sensitivity, and radically slowing down how fast your stomach empties, it essentially rewires how your brain and gut communicate about hunger. It turns out your gut hormones are way more complicated than we ever thought. But here's the catch. Forcefully rewiring your metabolism is a super heavy biological lift.
Section 2. The hidden side effects. Yes, Mounjaro is a massive medical breakthrough, absolutely. But here's the physical toll it takes on the body, which, surprise, surprise, rarely makes it into a glamorous social media post. Manipulating your gut hormones causes a whole cascade of physical effects. The clinical literature highlights widespread gastrointestinal distress. We're talking severe nausea, vomiting, and diarrhea, which are incredibly common. There are also documented risks of pancreatitis and gallstones. But you know what the most alarming side effect is for the casual aesthetic user? Sarcopenia, severe muscle loss. Because rapid weight loss literally eats away at your lean muscle mass. If you aren't strictly maintaining proper nutrition and hitting the gym for resistance training, your body doesn't just melt away fat, it starts consuming its own functional tissue. Crazy, right?
Section 3. The Discontinuation Dilemma.
So what exactly happens when those side effects become just way too much and a user stops taking the medication? Well, the harsh reality is that the weight often comes rushing right back. As Dr. Bachara warns in a recent article regarding Mounjaro's release, medication must be allied with physical activities and a balanced diet to avoid the accordion effect and obtain lasting results. The accordion effect, that rapid weight regain. Studies show that discontinuing these therapies leads to significant weight regain and completely reverses those amazing cardiometabolic benefits we talked about earlier. So if your foundational lifestyle habits aren't permanently changed, the drug is really just a temporary, incredibly expensive Band-Aid.
Section 4. The Unregulated Peptide Trap.
And this brings us to the absolute darkest corner of this whole trend. Because brand-name drugs are super expensive, strictly prescribed, and honestly often facing massive shortages, desperate people are turning to the unregulated internet to chase those exact same aesthetic results. People are out there buying unauthorized peptides like CJC12095 and ipamorelin blends straight online. Now, what's really interesting about this contrast is how terrifying it is. FDA-approved incretin therapies go through years of rigorous, double-blind clinical trials. They have proven safety profiles and precise dosing. But the gray market of online peptide blends? No way. Absolutely zero FDA approval for therapeutic use, no guaranteed product identity, totally unknown purity, and massive batch-to-batch variability. It is a huge risk.
And look, even in controlled studies of these specific peptides, we see side effects. Trial data shows that about 10 to 20% of users experience injection site reactions, localized redness, swelling, or pain.
and roughly 15% suffer from headaches, mostly due to sudden hormonal fluctuations. But remember guys, this data applies to lab-grade compounds. When you're buying this stuff off a random website, you aren't just risking a headache.
In fact, Health Canada has issued a very severe warning regarding these unauthorized injected peptides. Because they bypass literally all regulatory oversight, consumers are exposed to some pretty horrifying risks. We are talking about severe hormonal and blood sugar imbalances, plus serious liver or kidney damage. And because these peptides relentlessly stimulate the growth hormone axis, there's even a theoretical risk of accelerating the growth of cancerous tumors. If that wasn't bad enough, vials bought online have actually been found to contain lethal contaminants. Things like industrial solvents, heavy metals, bacteria, and even microscopic shards of glass. Literally injecting that into your body.
The fallout from this gray market is so bad that the medical community is actively having to adapt on the fly. Doctors are literally having to create brand new clinical flowcharts just to evaluate and triage patients who are showing up with completely unexplained endocrine or metabolic findings, all stemming from suspected unregulated peptide exposure. Clinicians are triaging acute visual symptoms, hyperglycemic crises, and severe infections coming directly from these unregulated DIY internet injections. It's wild.
Section 5. Why you need a doctor. So this brings our entire investigation full circle to an absolute medical mandate. These compounds are incredibly powerful hormonal modulators. They are not over-the-counter cosmetics. If you or anyone you know is using these substances and experiences any of these severe warning signs, like chest pain, fainting, a rapid or irregular heartbeat, sudden shortness of breath, a high fever post-injection, or severe hyperglycemia, urgent medical attention is required right away. It cannot be overstated, the line between a therapeutic dose and a systemic life-threatening crisis is incredibly thin, and managing that line requires a licensed professional, not some influencer's discount code.
As always, I want to be incredibly clear with you all. This explainer is strictly for informational purposes, drawn directly from published clinical articles and health agency warnings. You should never, ever start, alter, or stop any medical treatments without directly consulting your licensed physician.
Ultimately, the science shows us that while the frontier of obesity medicine is advancing brilliantly, the social media translation of it is dangerously flawed. Before you chase those curated results you see online, ask yourself this. If the cost of a quick fix is the potential destruction of your long-term health, your muscle mass, and your endocrine system, are you really losing weight or just losing yourself? Now, if you want to really understand how to lose weight safely, effectively, and permanently without relying on dangerous internet trends, you absolutely need to grab my new comprehensive ebook. It is the ultimate guide to sustainable metabolic health, and right now it is only $19.90. Seriously, for less than $20, you get all the proven, science-backed strategies to transform your body the right way. Do not miss out on this. Click the link in the description to buy it right now for just $19.90. It is a total game changer, and it will save you so much time and trouble. Grab it today. Thanks so much for watching. Remember to like and subscribe, and I'll catch you on the next one.